Hi everyone, today we are going to be talking about burnout and how to understand burnout, why it happens, and how to manage the risks. So you've probably heard the term burnout a lot up until now, and not just in relation to counselling. Burnout impacts workers in all kinds of different fields. The research on burnout, however, started with helping professionals. So it originally started with alcohol and drug counsellors. Freudenberger was the first researcher who looked into the burnout syndrome. And it does seem to impact people who work in the mental health professions or the helping professions more often. And it does appear to be the biggest workplace risk to us as mental health professionals. So I think it's worth understanding what it is and how to prevent it from impacting you. So burnout is more than just being really stressed. So that's an important distinction. It's the result of chronic stress. So you might find that you're stressed about doing an assignment and you don't sleep very well for a few days and you feel kind of uptight and your muscles are a bit tight and things like that. But once you've had in the assignment, you feel a relief and you feel less stressed. So burnout is a result of chronic longer term stress. And there's three components to burnout that sets it apart from the regular stress response. The first one is emotional depletion. So that's when people feel like they have nothing more to give. They're just empty. They find it more difficult to empathize and to share themselves in the work that they do. And as you know, we put ourselves into counselling work, and when you feel emotionally depleted, you feel much less able to do that. And that can be really, really shocking and devastating to people who feel really a real drive to help people when they feel depleted and they feel unable to do that anymore. Feelings of incompetence. So that doesn't relate necessarily to your experience as a student where you feel like you don't know what you're doing, and that's a normal part of developing competency. So feeling of incompetence refers to someone who previously felt competent in their work and they slowly start to lose that sense of competence as a result of burnout. So they start to question, I don't know what I'm doing anymore. I don't think I'm helping anybody. Those kind of thoughts and feelings. And, you know, as a result of the feelings of incompetence, people can tend to become more rigid with how they're approaching clients. They might, you know, take more of a rigid stance on the approach they're taking. So they might stick to one theoretical approach rather than being more person-centered or being more client-centered, and working with the client on what they need. So they might decide that they're a CBT therapist and they will only use that despite the fact that it doesn't really fit for some clients. So that's a way of, I guess, defending against that feeling of incompetence. Depersonalization refers to a sense of people becoming less human and more another demand on you. So you, instead of feeling for the person in front of you and understanding that they're a human being and they're in need, you just see them as another source of demands. So depersonalization can be really shocking for helping professionals who were previously very dedicated. So that's the difference, I suppose, in the burnout syndrome to feeling stressed. Those three aspects set burnout apart. The other thing to remember about burnout is that it doesn't just come out of nowhere. It's a continuum and it's a process. So burnout is a result of chronic stress, and so someone might be feeling fine and they, have a very high workload, they have stressful work, but it hasn't started to impact them yet. Whoops. And then they might find that they're finding that stress is starting to impact them a little bit. They're starting to feel tense or having trouble sleeping or getting a bit irritable, or maybe they're drinking a little bit more than they used to in order to deal with their stress. And it's at this point where intervention is needed. So we need to start to recognize when stress is starting to impact us before it becomes a chronic problem and becomes burnout. So the point between the stress starting to impact you and full-blown burnout is where we really need to intervene, because it's very difficult once someone reaches that full-blown burnout stage. It's much more difficult to treat and to recover from. And certainly some research suggests that people with a very severe burnout can take up to 2 years to recover. Or they may leave the profession altogether. So we really need to start noticing stress signs and symptoms and intervening when they start to come up. So we can go from the stress starting to impact us back to feeling fine again. And that would be the ideal scenario. It's where people's are not noticing what's going on for them and not noticing the impacts of their job on themselves, that they'll reach that full-blown burnout. So what causes burnout? Well, there's been a lot of talk about the idea that certain kinds of people burn out, like people who aren't cut out for the kind of work that they're doing, or maybe they're not resilient, or they don't have symptoms. Not symptoms. They don't have strategies to deal with stress and so on. And that kind of attitude has been completely debunked in the research. So it's clear that from lots of studies that it's less about the individual and what kind of person they are, and much more about the workplace and different conditions in the workplace and what's going on in the workplace. However, that idea that it's more about the kind of person you are, that contributes to a stigma around burnout and seeking help for burnout. I'll talk more a little bit about that later on. So the factors that have been found to really contribute to burnout is, first of all, work overload. So that seems pretty obvious. Work overload relates to so maybe having too many clients, maybe having too much paperwork, maybe not having enough time to complete your paperwork, maybe working too many days in a row, overtime, that kind of thing. So basically, the demands of your job exceeds your resources. Secondly, lack of control and autonomy. Now, lack of control and autonomy surprisingly has a greater effect on people's experience of burnout than work overload. So there's been some studies where in some organisations they've increased people's control and autonomy in their workplace. So that means giving them a voice and giving them a say in the way that their workplace runs and what kind of work they do and how they do it. So some autonomy and some voice. And the researchers have found that has a greater effect on people's levels of burnout than work overload. So if they give someone a voice, but the workload stays the same, they found that burnout still goes down. So having a voice in your workplace and with your boss and the way you do your work and when you start would be, that all has an impact on burnout. Insufficient rewards, so that doesn't just refer to money, but it does refer to money as well. So you want to be, you want to feel like you're being paid fairly, but it also relates to recognition. So if you feel like you've worked really hard and you've put a lot into a project, having your boss recognize that, give you recognition for it, is another form of reward. So if you feel like no one's kind of noticing your hard work and you're not getting paid enough and you don't receive any positive feedback, then that would be considered insufficient rewards. And you feel kind of demoralized by that, which leads to a lack of kind of meaning in what you're doing. Breakdown in community. So that refers to often the workplace and your colleagues and your boss. So in some workplaces, you may have already experienced this before, there is an element of incivility or general kind of rudeness, and that can really impact on people's experiences of burnout. If people aren't, respectful, are a bit snarky, a bit rude, that can be really contagious in a workplace, and it can be it can catch. So that it ends up being the way that people treat each other in the workplace. Whereas if you work somewhere where you feel supported and you feel respected, that can really protect you from burnout. So that's worth looking for when you're out in the workplace. Absence of fairness. So obviously we all want to feel like things are fair. Some more than others, like I spoke about last week when we talk about beliefs. Some people have a real strong need for fairness, and if it feels like some people are treated differently, so workloads are handed out differently, or special privileges or special assignments, that can really affect you as well. Values mismatch. So that's when you're asked to do things that don't fit with your values. So maybe you're asked to so one example would be when I at the beginning of my career, I did some work for in injury management, so rehabilitation, and I found that I was being asked to act in the best interests of the insurer rather than the client. And so that's an example of a values mismatch where I was asked to act or to work with clients who are going through workers' compensation, but act in the best interests of an insurer rather than the person in front of me. So naturally, I didn't last very long in that area. Okay, so these are some of the symptoms that people experience when they are feeling burnt out. So you've got the physical side of things. So When you feel stressed, you have a reaction called the fight or flight response, where the blood rushes away from your major organs like your stomach and your heart and so on, and it rushes towards your muscles. So you can either fight someone or run away. And that's our, primitive response to a perceived stressor. Now, if we have chronic stress, that means that response is there pretty much all the time, which means that our major organs, are not performing the best that they could be. And so you find that people have, maybe IBS, irritable bowel syndrome developing, or, great fatigue, or their immune system has started to be affected, or they start to get headaches because of the chronic tension in their neck and head and shoulders. Start to develop sleep issues or appetite, or maybe they're eating maybe too much in order to deal with the stress, palpitations in their heart, that kind of thing. People sometimes also put on weight because of the excess cortisol that's running through their bodies over a longer period of time. So that's what happens when our stress becomes chronic and we don't address it earlier on. Psychological, so those feelings of feeling incompetent or useless, dreading going to work is a really good indicator of burning out. A feeling that you can't delegate to anyone. I can't trust anyone to do right. I have to do it or it won't be done properly. Those kind of beliefs and attitudes can be a sign that you're becoming more rigid, and you're defending yourself against a feeling of incompetence. Becoming quick to anger, getting forgetful. So there's certainly some studies that suggest that even when nurses are burning out, they make more mistakes and there's a greater risk of infection to patients. So we find we make mistakes and forget things and have trouble concentrating when we're starting to burn out. Behavioural signs can be things like closing off to feedback, or becoming very rigid in your approach, or getting angry when someone gives you feedback. With withdrawing from colleagues, so starting to eat your lunch in your office instead of in the lunchroom and things like that. Becoming really cynical, dropping your self-care altogether, and losing your boundaries as well. So starting to disclose things to clients or maybe to just general people that you wouldn't normally. So losing a sense of what's appropriate to be disclosing about yourself. And if you find that when we've talked about self-disclosure, but if you find that you are having trouble with wanting to disclose more, that maybe is a sign that you need to not disclose at all for the time being, because perhaps you're struggling a little bit. So this is one of the impacts of burnout that is different to just the regular stress response. So it really impacts on people's sense of the meaning of their work and of life as well, because often you find that people who are drawn to the helping professions are drawn because they want to make a difference, and they start to feel like they're not making a difference or they can't make a difference. So it can really lead to a loss of hope and direction and inspiration and all those things. So that can be the most devastating part of burnout for people. So you'd find that most people in the field, so most counsellors and alike, are aware of what burnout is and are probably aware of things like mindfulness or relaxation or self-care strategies in general that can help with burnout. But it is still the biggest occupational hazard in our sector. So it's still a big problem. So, and that's, I guess, the conundrum of why, when we know how to look after ourselves and so on, why is it still such a problem? Well, one of the reasons is that, like I mentioned before, it's not so much about the individual, it's a lot to do with the workplace. But also we find that people who are starting to suffer or to feel the effects of their stress, when they're a mental health professional, they find it difficult to get help or to even tell anyone that they're struggling. So their help seeking is affected by their idea of themselves as a helper, which leads me to talk about role identity. So when someone becomes a counsellor, they start to develop a role identity, and that happens in every profession. So doctors, lawyers, fitness instructors, teachers, they all develop an identity that is taken on board in response to the values of the profession. And they start to understand themselves within a community. So counsellors would see themselves within a community, and they start to identify with a community, whether that be a certain, like, imagine if you're a psychodynamic or counsellor, and you start to identify with that community and understand yourself within that community. Or maybe it's generally as a counsellor, or maybe it's as an alcohol and drug counsellor, or a relationship counsellor. And it's important that this role identity develops, because it means that a professional has integrated themselves with the ethical and moral imperatives of the profession. So it is an important aspect of becoming a counsellor. And certainly we find that certain attributes are valued in the counselling profession in general, such as being competent, having emotional stability, having some self-control, helping others, acceptance, being empathic, being free of emotional problems. And that role identity isn't just developed within the counselling profession, it's also influenced by the attitudes of the general public. So the way they see counsellors as people who are generally fully functioning, have good relationships, make good decisions, are generally free of mental health issues and so on. And we know that that is not necessarily the case, because at the end of the day, counsellors are just people. However, when someone develops an identity as a counsellor, they start to value those attributes. So when someone's role identity is around giving care and being free of distress, when something happens in your life, you know, like maybe you start to become anxious, or maybe you go through a divorce or something like that, or you start to feel burnt out, asking for help can be difficult when you have a very strong role identity. And that's why we find people from the helping professions are less likely to get help when they're starting to struggle. So when someone starts to feel burnt out, that's not congruent with their identity. So that feeling of incompetence, that feeling of not having anything more to give, is not congruent with their identity, and therefore oftentimes people can put more energy into covering that up or to trying to maintain that identity. So they might find that they're giving more with clients or doing less self-care or taking more work on. And you can see where that will go. That creates that perfect storm of burnout. So a more helpful identity for us would be to recognize that we're human beings, first of all, and we're just the same as anybody else. Just because we're counsellors and we have knowledge around mental health and coping strategies and so on, we're just exactly the same as everyone else. We struggle, we have difficult times in our lives, we have our sensitivities and our vulnerabilities, and that's really, really important to remember, is that you're human before you're a counsellor. Acknowledging that what we do can be rewarding, but sometimes distressing. So acknowledging the fact that even though it's really meaningful work, it can sometimes be distressing. Being aware of our recent stresses that we've experienced. So if we're finding that our work is fulfilling, a little bit stressful, but generally can cope well with that work or with the client work, and then something happens in our personal life that impacts the way we're feeling, that can really impact on our overall capacity to cope with our work stress as well. Identify ourselves as a fully flawed human being, not immune to mental health issues or relationship problems. And that is a huge one. And I think it's one that people struggle with no end. But if you can try and see yourself as fully flawed, and that being a useful thing in developing empathy and understanding for our clients, because we've been through our own stuff, it can really help protect you from burnout. So the pink elephant refers to the fact that quite often you'll find that various people in the workplace might be feeling burnt out, but they tend to hide how they're feeling because of the idea that we should be able to cope. And certainly in the research that I've done on mental health professionals, it's a big thing, this self-blame and self-stigma that people attach to themselves, that they shouldn't be feeling burnt out, they should be coping better, and therefore they hide their symptoms, they hide how they're feeling, which means that they don't get that help, and it goes on for longer than it needs to. So as I spoke to you about the continuum of burnout, it's better to intervene when you start to feel the effects of stress rather than when you start to feel fully burnt out. So prevention is better than the cure. So some of the resources that can help protect us against burnout. So there's 4 elements that we use as counsellors to measure our success as counsellors. And the first one is appreciation. So that's when a client says, "Oh, Marika, you've changed my life. I'm feeling so much better now. You know, I would never have been where I am today because without you." So that happens a lot less than we think it happens. So oftentimes a client will improve, but it'll take longer, or they'll only engage in therapy for a period of time, and then they'll go off and into their life, and things get better over time, but you don't actually get that feedback. Or there's other things going on in the client's life that impact their ability to change, or their ability to feel better. So we have very little control over the appreciation or the change that we see with our clients. However, that seems to be the area where counsellors tend to measure their success the most, which is risky because we have very little control over that. Recognition as well is something that people tend to value highly, but we have very little control over it. So that's getting approval from your supervisor or your colleagues that you're a good therapist. Now, as we know, we can't always get our boss to say, oh, you know, you're doing a great job, because often our boss has millions of other things going on in their head and in their work, their list of tasks that they need to do. So we have low control over that too. What we have control over is the ability to keep our skills up to date and to keep developing our knowledge. So that's when you finish your masters, you go off into the field, and you keep training. You keep doing professional development courses. You keep developing your skills and developing a niche that you can work on your skills in. So, you know, finding an approach that really speaks to you, or finding a method or techniques and training and working on those and developing some expertise in that, so you can feel like you're working on your own competence. And that's something you have control over and therefore can protect you from burnout. The other thing that we have control over is working on our ability to develop a therapeutic relationship. Now, obviously, there's other factors, client factors, that come into play when it comes to a therapeutic relationship, but putting our efforts into developing a therapeutic relationship rather than measuring our success on the amount of change that we see is a better strategy to deal with, to prevent burnout. So I like this quote, outcome is determined to a great degree by the client and outside events, not the therapist. And that just goes back to the idea that client change or improvement is largely determined by other factors. And so if we can focus on that therapeutic relationship, we'll be protecting ourselves from becoming demoralized. So often people enter the counselling profession with high expectations of the change they're going to make. And they're often quite unprepared for the lack of gratitude or or appreciation expressed by clients. And they're often not prepared for the fact that it's a very one-sided relationship, which is how it should be. It's very difficult to measure our effect on clients as well. Sometimes the impact you have on a client will be felt months down the track. So, you know, you won't know the difference you've made on a client until maybe you bump into them years down the road and they say, you know what, those 2 sessions I had with you were really the turning point to me changing my life, or to me seeing things in a different way. But you had no idea about that before that point in time. Sometimes there's a belief that if I'm skilled, warm, intelligent, knowledgeable, and caring enough, a client will improve. And that's a recipe for burnout because, as I've spoken about, there's other factors at play here. Okay, so I've spoken about how we need to start noticing our first signs of stress and intervening when we start to notice that stress is having an impact on us. Now, we all have different first signs. So some people find that they maybe start to feel quite negative or have a really negative kind of mindset, and that's their first sign of stress. There's other people find that they feel overwhelmed, like, I can't deal with all of this. How am I going to do it all? Or they start to feel irritable. Or maybe they find that they start to sleep too much, and that's the first sign. Or maybe they start to withdraw from other people. They start to feel less likely to want to catch up with people or to talk to people. Or maybe you find that you've got physical symptoms like headaches. So it's important to think about times in your life where you have been stressed and what were the first signs for you? Is it an inability to concentrate? Or do you find it difficult making decisions? So think about what it is that causes stress for you. What are the first signs of stress for you? And then we want to think about what causes stress for you. So that's different for everyone as well. So sometimes it could be workload, having too much to do in a short period of time. Sometimes it's not feeling enough control. So not having a voice, feeling undermined, not consulted. Sometimes it's about relationships. So feeling like people aren't respectful or rude. Sometimes it's about your role, so not feeling sure about what the limits of your role are. Sometimes it's about not feeling that security in your role, or not having enough resources, feeling out of your depth. That can be really distressing for some people, but not for others. And change. So sometimes people find that change is a real trigger for them. So think about, for you, what are the things that really that you struggle with, that impact you the most? So you can be aware, there's a change happening in the workplace. I know this is one of my triggers, and therefore I need to use more strategies and more ways to protect myself from being impacted by this. So individual strategies to deal with burnout. I like this this picture of the car going up the hill, because usually when people hit a hard time, or their workload increases, or they start to feel stressed out, they start to often work harder. So they start to do more work or try harder, or shift up a gear basically. Whereas when we're going uphill in a car, and we reach a point where the engine's struggling, what do we do in a manual car? We would shift down a gear. And that's what we want to try and do when we start to notice symptoms of stress within ourselves, is we want to shift down a gear, not up a gear, which goes a little against our natural response to stress. So we need to figure out, we need to pause, we need to think about these symptoms and scan our bodies, scan ourselves, and see what's affecting us at the moment and how is it affecting us. Think realistically about the stress you've been under at work, but also at home as well. Set yourself some realistic goals. Is it realistic to be functioning at 100% all the time? Possibly not. Set some goals for the week that are achievable. So this week, I would like to develop a new resource for clients, and then acknowledge when you've achieved that goal. Celebrate your successes. So when you're counselling in your practice sessions, it's important that you reflect on what you've done well and not just what you need to improve on. That's a really critical thing to get into the habit of doing, is to reflect on, I think I developed that therapeutic rapport well today. Or I think I asked some really good open questions today, not just focusing on, I messed up that paraphrase, or that summary was really clunky. So really celebrating our small successes. Figure out small ways you can have control and autonomy over your work. Discuss with your boss and your colleagues about how you can do that. So that's really important, is to find ways that you can control the way you work. You know, for example, I'm not great in the morning, and so I choose not to see clients before 10 o'clock in the morning. And that for me is a really important way of managing my workload and managing my work day that improves how I feel. Actively seek positive feedback. So if you find that your manager is too busy to give you that feedback, seek them out and say, is there anything you find, is there anything I'm doing that I could improve on? And is there anything I'm doing that I'm doing well? Don't feel like you're being needy. It is an important part of managing your stress, is to know what you're doing well. Work on something new that interests you. So whether that be learning a new technique or a new approach, or doing a project at work that interests you, it's important to add things into your work day and work week that inspire you and to make you feel like you're learning something new. So taking breaks, taking 5 minutes between you know, sessions, or you know, if you've had a difficult meeting, taking 5 minutes just to decompress is really important. Taking pauses throughout the day. So being mindful that we need to just stop and be, and to scan how we're feeling throughout the day. So 5 minutes doing nothing is important. Try and have your lunch away from your desk, or even away from the office if you can. Being careful with overtime. It might seem like it's a good idea, but over time it can have an impact. Be careful about checking emails at home, because it means that you're not shutting your mind off from work when you're at home. When you start to feel stressed, taking a day off can really help. And it's better to take a day off when you start to feel a bit stressed out than 6 months down the track when you need to take a month's stress leave. So it's much better to nip it in the bud and to realize I just need a break. And making holidays a priority. So some of you have probably already experienced going on holidays and it taking about a week to kind of relax. So that's why taking 2 weeks off is always a good idea if you can. Now, these 2 books are really useful. The Resilient Practitioner, it's very comprehensive, and it's got lots of ideas and strategies to help you manage the risk of burnout. Help for the Helper is really useful with techniques to deal with difficult feelings that can come up in sessions. So say, for example, you're getting triggered by something that the client's saying. There's some really helpful practical strategies to manage those times in the Help for the Helper book. Both of them are useful, and if you buy them, they're not very expensive online, and I'm sure you'll use them throughout your career. So when we talk about relaxation, it's useful to think about it as, yourself as a bank account. So your client work and, your project work or whatever it is you do at work takes out of your bank account, because you're using your energy, you're using your emotional energy and that kind of thing. And so we need to think about relaxation as depositing back into that bank account. And that often requires us to be very deliberate about deciding, I'm going to have some relaxation time. I'm going to do something that is going to bring on that relaxation response. Now, the relaxation response cannot coexist with the stress response. They're opposing. Some of you probably remember from human biology in school that the relaxation response switches off the stress response. And so that's why it's so important to be deliberate with our practice of bringing on relaxation. And different things work for different people. So sometimes people find that they like yoga, so more kind of body work, moving their body and being aware of their body. Sometimes people find massage is really good, meditation, but some people find meditation stressful, so it doesn't work for everyone. Mindfulness, smartphone apps can be also used, like the trying to think of the name of the app. I think it's called Helping Minds. Anyway, there's a lot of apps available now for relaxation and mindfulness. So you can just download one of those and use that regularly. Decompression. So it's important to find a way to decompress between work and home. And, you know, that's something that I've noticed in during the period of isolation, working from home, is that you need to find a way to create that barrier between work and then being at home and your personal time. So find a way, whether it's going for a walk between, you know, finishing work and being at home, or finding a way to decompress and to draw a line between work and home. For me, you know, I like to go out and water the garden between finishing work and having, you know, your home personal time. And that for me is that drawing the line between, you know, thinking about work and thinking about, you know, just being at home. So we need to have a deliberate self-care strategy. So it needs to be deliberate. It can't just be, oh, I might just sit down and relax a bit now. We need to think about, so tomorrow I'm going to make some time to read that book. I'm going to make some time to go for a walk in the morning, or, you know, how are you going to do it? Be deliberate about it. Supervision is really important because it keeps us honest about how the work is impacting us. It helps debrief things that have been bothering you, or self-doubt that might be bothering you. So when you go out into the workplace, you will engage in clinical supervision, and that's a really important process. Don't see it as a kind of critical thing. It's not about people, your supervisor, looking to see what you're doing wrong. It's about supporting you and your well-being as much as anything. Find your niche. So what do you really like to do? What kind of clients do you like to work with? What kind of approach do you like to use? Or sometimes people find that working with two different kind of populations works well for them. So maybe they work with, or for example, for me, I like to work with couples as well as individuals. That mixes things up for me quite well. Be aware of the balance of your personal relationships. So as you become a counsellor, you might notice that previously you've had quite a few relation or friendships that may be one-sided. Maybe you're the person who's listening to them, providing them with support. Be aware of that. Doesn't mean you need to ditch those friends, but be aware that you need balance in your life. So you also need friends who are there for you. Yeah. So be aware of that balance. And as we go along in our careers, we need to constantly develop ourselves. We can't just go, right, done with my master's, I know everything about counselling. It's a constant process. So constantly looking out for things you can be learning and improving on. And that helps to maintain a sense of competence. We know that people find it difficult to notice when they're burning out. And that's usually because when people start to get stressed, our ability to assess ourselves and to make decisions is impacted. And so it's important to be supportive of your colleagues and to help support them recognize when they're being impacted by stress. And again, you know, when thinking about that stigma attached to burning out, we need to normalize it. We need to remind each other that we're all human. We've all got struggles. We've all got finite energy. None of us can just keep on going. It really is a great buffer when colleagues are able to support each other. So that's a great prevention strategy. The research suggests that when colleagues support each other and check in and see how each other are coping, it's a really good buffer against burnout. And remember that the attitudes of colleagues can have a big impact on whether people seek help. So be mindful when you notice people talking about a colleague saying, oh yeah, maybe they're not cut out for this kind of work, or maybe they're just, you know, not resilient enough. Be aware of those kind of attitudes and how they really impact on help seeking amongst helping professionals. And it creates a cycle of overwork and then lack of help seeking. So don't be part of that. All right, so to summarize, understand that burnout is a risk as a helping professional, and show yourself some self-compassion. So understand that you're just human at the end of the day, and you've got the same fallibility as everyone else. Look for those early warning signs. Be aware of what yours particularly are. Concentrate on the elements of success that you can control, not on what you can't control, and help each other. So notice how each other's coping and provide support for each other. All right, thanks very much, everyone. I hope you got something out of this presentation, and I look forward to talking about burnout with you in the future.